Here we will draw the arterial supply of the spinal cord. Begin with the extrinsic system. Draw an axial cut through the spinal cord on one side and an oblique coronal cut on the other. Indicate that a single anterior spinal artery descends the anterior median fissure and that a pair of posterior spinal arteries descends the posterior spinal cord. Next, in the axial cut, show that generally the anterior spinal artery supplies the anterior 2/3 of the spinal cord and that the posterior arteries supply the posterior 1/3. Now, on the coronal side of the diagram, draw the vertebral arteries. Show that near where they join as the basilar artery, vertebral artery branches form the anterior spinal artery. Then indicate that each vertebral artery produces a single posterior spinal artery. In many instances, however, the posterior spinal arteries originate from the posterior inferior cerebellar arteries instead. Now in our axial diagram, show a source artery and an attached segmental artery. Segmental arteries help supply the anterior and posterior spinal arteries throughout their descent. The source arteries and segmental arteries vary along the superior-inferior length of the spinal canal. Throughout the cervical spinal cord, the source artery is the subclavian artery. The segmental arteries in the upper cervical spinal cord are the spinal segmental branches of the vertebral arteries, and in the lower cervical spinal cord, they are the ascending cervical artery from the thyrocervical trunk and the deep cervical artery from the costocervical trunk. In the thoracic and lumbar spinal cord, the descending aorta is the source artery. The segmental branches in the thoracic cord are the posterior internal costal arteries, and in the lumbar cord they are the lumbar arteries. Finally, in the sacral spinal cord, most commonly, the source artery is the internal iliac artery, and the segmental arteries are the lateral sacral arteries. Next, indicate that where the segmental artery divides into ventral and dorsal branches, the dorsal branch is called the dorsospinal artery, and it forms three types of radicular arteries. Show that the radicular arteries proper, anterior and posterior, supply the nerve roots. The radiculomedullary arteries supply the anterior spinal artery, and the radiculopial arteries supply the posterior spinal arteries and also the pial network. Indicate that the pial network is a ring of arterial supply that surrounds the spinal cord. It has superior-inferior interconnections throughout the coronal axis of the spinal cord that form an arterial meshwork around the cord. Note that the most important radiculomedullary artery is the artery of Adamkiewicz, which in the majority of people arises from T9 to T12, but can originate from anywhere from T8 to L3, and it most commonly originates from the left side of the body. Injury to this artery often leads to paraplegia. Now let's draw the intrinsic arterial territories in axial view. They divide into the centrifugal and centripetal systems. Show that the centrifugal system comprises sulcal arteries from the anterior spinal artery, which supply the spinal cord from central to peripheral. They primarily supply the gray matter horns. Then indicate that the centripetal system comprises vasocoronal perforating arteries from the pial arterial network, which supply the spinal cord from peripheral to central. They primarily supply the white matter funiculi. This concludes our diagram.